Bonjour. Good morning, everyone. Thank you so much, Dr.
Hold on.
Kumari, for this kind invitation.
1 second.
I'm
Just
really
hold on for a
pleased to
minute.
be here today, and I think that any form of violence, meaning when someone take the decision on my behalf, and that may have an impact, especially a negative one, on my health, this is violence. You can call it psychological violence, you call it psychological abuse, you call it whatever you want, but at the end of the day, women are not able to take the best decision for themselves. So this is why I'm happy to be here today. And I'm going to try to convince you that misinformation and disinformation is really a silent enemy because we don't see it, but the impact is there. So when Shanta asked me to give this presentation, I did some extensive literature review to try to find science behind that. So this is what I'm going to be sharing today with you. So I don't have any conflict of interest. And as I said, I'm really happy to be here. I think that I've been working with FOGSI since last year when I had the privilege to meet Dr. Kumari. And it's hard to come after her because she's done so much on these topics to fight the violence against women. So I was really impressed last year when you had this panel presentation in Hyderabad, and when you had all these public representation, education to girls. And, you know, the problem is that depending on where we live, we may have a different definition of what violence is. And this is why I think that always keeping our eyes open, it's the way that we're going to be able that we meet all the goals of it. There's many forms of violence, so I was really impressed by what Shanta did last year when there was this violence against doctor. And even if this was a women's doctor who was killed, as you know, in your country last year, nevertheless, you know, sometimes it's interesting when you're a foreigner, you see things that we don't see because it's our day-to-day activity. But, you know, coming from a country where life is much easier, it's obvious that physicians in your country have, you know, victims of violence. And once again, this misinformation, disinformation has an impact on that. So I'm going to talk about it as well. So this is a funny representation of my slide, but that's sometimes just the computer. So why is it a form of psychological violence? Well, the fact that it is so easy to spread whatever online is the best way to get in touch with the most people that you would never think, because everyone that are in front of their computer or their cell phone will feel that we talk to them. So let's get a little bit more into details. And this is the reason, and I put some picture on this slide because this is what caught my eye and make me work on this topic. Because if you look, I don't know if the pointer will work. Where do I? Oh, there it is. If you look at this here, this is the peak of maternal mortality related to the first wave of COVID. And these data come from the US. Unfortunately, you see how bad it is. And I think that sometimes pictures are worse than words. And why was that? This is all the Hispanic women. We don't know exactly where it came from. Was it the anti-vax group? Was this the religious representative? Was it social media? Was it family? But nevertheless, at the end of the day, these women died. They died because they decided not to get vaccinated. And this is bad because we could have avoided. Then it went down a bit because we had a little bit more data. Obviously, social media were all over the place to convince women that vaccines were dangerous. And I'm not a pro-vaccination or an anti-vax. I'm pro-choice. It's your body. It's your choice, but it's your choice. It's not your husband's choice. It's not your mother-in-law's choice. It's not your nurse sister's choice. It's not your physician husband's choice. It is your choice. You have to own it. So in the hospital where I work, we have a lot of Jehovah's Witnesses. And as you may guess, in Canada, we are very strongly pro-choice. So whenever a woman decides that she's pregnant and she's going to deny any blood transfusion, then we have this extensive consent to avoid what we just saw in the prior lecture, all this litigation. And we just make sure that it is her choice. And whenever we meet them, we say, well, if this is what you want, we're going to get it done. But make sure that this is really, really, really what you want. And we're going to ask you 100 times, because when I'm an OB-GYN and you ask me to let go a woman that I could save her life, I'm going to challenge you as many times as needed to make sure that it is your choice. And it's not to make her change her mind, but just to help her realize that when you make a choice, you have to own it. You have to own the consequences of it. But you have to get the best information to make sure that you made the right choice. So obviously, when we're talking about social media, we see everything, the best and the bad and the ugly, and this is where women get caught. So why does it matter? Well, it matters because it affects a woman's autonomy in her decision-making, and as we saw, it can lead to very, very bad health outcome leading to death. So it is not a minor thing. It is not, I like to have my hair blue, red, black, or white. It is something worse than that. It is influencing women to make a decision that may be against their best wishes, and doing that in a way that they don't realize what they're doing. And why is it important? It's because it has an economic and societal impact that I'm going to be showing you in the next few slides. So I don't know if you've seen this report. This is something that we've been using in my job of CEO at SOGC now. So this was presented at the Economic Forum in Davos last year, showing that women are not healthy at all. So women are way from being healthy because we never talk about that. We never talk about money. When we talk about women's health and women's right, we only focus on the possibility for her to make the best decision. But there's a lot of big bucks behind that. And if we want to empower women in their decision and make sure that they're going to get the best information, we really have to start about money. I like to talk about money. I like numbers. I like to get involved into that. And I like to have this business case approach when I talk about women's health, because especially when you meet government representatives, that's all they listen to. So this is one of the actions that we need to start doing. In this report, when you look, and this is again showing that women spend 25% of their reproductive life in being in a bad health condition, you could see that women are disadvantaged at 64% and men are just 10. Why is that? Most of the time it's because we don't have any data. We don't have any women being part of big research protocol, because sometimes they are declining the reproductive age because everyone is afraid that the women will get pregnant and then they have to pull away from the research and they will lose their funding. When we look at data, and this is Canadian data, even though we are pro-choice, pro-women, we have our place, we're taking all these leadership positions, at the end of the day, only 25% of the research in Canada is done by women researchers, and we have to stop that. And once again, we need to speak the language of money and show it with numbers. If we look, and I like this slide because this is something, again, that we have to talk about. And if ever I could be in a powerful position enough to change this nomination, here, when you look at that, these gynecological conditions that we called benign. Is it benign to have endometriosis when you're going to miss work a couple of days every month? Is it benign to have premenstrual syndrome so bad that you want to kill everyone around you for a week per month? Is it benign that you're bleeding and you have to bring a change of clothes to your school or to your work because you don't have the right treatment, either because you don't have access, you don't have the money, or your primary healthcare provider doesn't know about it? There's absolutely nothing benign about it. So this is, once again, when we talk about women, we only talk about cancer, which is good. I mean, we need to do research in cancer, but nevertheless, those conditions are not benign. They're really affecting their life and their way to be able to go back to work, get money, take care of their family, and be happier. But if you look at it and start talking about with dollars in your mind and in your mouth, you're going to see there's a huge market there, not only for drug company. There's a huge market of being able to bring these women back to work. And the best example is probably now all the big cohort of women who are entering menopause. And these women, when they are treated, they can easily go back to work and take the big position that they've been working for forever. And there's money into that, not only for drug company, but for having more human resources. And when you look at it with a different perspective, you see that the United Nations has called that in 2030, probably there's going to be a shortage of human resources of 30%. That's bad. Who's going to treat us? So we need to make sure that these women will be treated, be able to go back to work, and be able to do what they've been studying in when they were younger. And just to close on that part of the topic, if you look at it from a GDP impact perspective, you see that it's not cancer that keeps women away from going to work. It's premenstrual syndrome, depressive disorder, migraine, other gynecologic problem, and these come for 35 years of your life in your reproductive life. And if you have a few kids like we do in Canada with a fertility rate of 1.4 per women, that's many years that you're going to be affected by that. So why is it important that we worry about misinformation in women's health? It's because we are facing different needs. We are in the reproductive health, in menstrual health, in menopause and chronic condition. And this is where accurate information is critical, so women can make the best choice for themselves. And this brings systemic inequities because, unfortunately, we realize that it's mostly women of color, religious community, and low-income groups that are going to be affected by social media. And this is the bad news about all of this literature that is starting to be there, is that we set the table, the medical community, not to be there when women ask their question, not to be available when they have question and that they're not able to get an appointment, or just not to be listening to them. Because when you go back to these benign conditions that keep women away from work, most of the time, in a disease like endometriosis, where the time before you get a diagnosis could be as long as 8 years, they're going to tell you, I saw so many physicians, and they always told me it was in my head. So social media don't tell them that. So this is why it is so appealing to find a cure for your problem. So what's the difference between misinformation and disinformation? So misinformation is false or misleading information regardless of the intent, when disinformation is shared by someone who is aware that it is false, but intend to deceive or influence others. So how does it spread? Misinformation spread through social media algorithm, to social media influencer, and through AI. So let's have a closer look to it. So what is an algorithm? An algorithm is, let's say you want to look at infertility. So and we're gonna go in details on one in the next coming slides. So you just put that word, and then it brings you somewhere in what we call an echo rule. And then they ask you question. And unfortunately, women always think that if you're not putting your credit card number into the chat, no one cares. You could write whatever. Yes, maybe. But when you're looking to find an answer, you're going to put your personal information, your weight. Do you have androgen excess syndrome? Do you have a history, a personal history? Did you ever have any treatment? So all these information are used in this algorithm to bring you in a special place that we call an echo room, where we're going to be shooting you a lot of content that is being pushed by the person or the company that is paying for all this program. What about the influencer? So influencers are paid to do that. Influencers don't have an ethic code. Influencer doesn't care if they tell you to do something wrong, like not getting vaccinated, no matter if you don't really understand what is going to be the impact of it. If we use example like the HPV vaccination, when the young resident that I'm training now, they never seen a condyloma on their life. When I started to train, there were so many, we could spend hours lasering them. This has an impact, but if we don't tell the truth, how can you know? So we have to always bring back the truth. And the social media influencer usually work like the pyramidal sale business model, so they have more reach and they bring people to sell whatever message they want to sell and just repeat it and repeat it. And as we saw in a country close to mine, when you repeat something that is not wrong, like the fact that we heard during the election campaign in the US that immigrants used to eat cat and dogs, people started to believe it. And this is bad. This is really, really bad. But when something is false, if you repeat it enough in some people's mind, it's just going to become true. And then there's AI generated content. So did you recognize me? This is me, this robot. So we can do whatever. You can use my voice, you can use my name, you can use my CV, you can use my credential. Now there's a little device that we use at the office to do podcasts. So you're just gonna give a talk, just put in the software, it's gonna do the best podcast using your voice with my French accent and everything. It's terrible. So if I have an impact in getting a control on the topic, I'm going to be fine. But if someone with bad intention use it, they can make me say whatever they want. And this is really scary. And this is where we need to teach, especially young folks, how to see that. Because there are fake medical profiles, there are fake healthcare professionals on social media, and we have to make sure that women know how to detect them. So who's creating this and why? Obviously, the why is the big dollar sign. There's a lot of money in this business, and this is why. And sometimes there's also in other fields, not only in women's health, if you make women feeling that they are a failure, they're not going to argue to have a better salary. They're not going to argue to have a better place on the sun. They're just going to believe that they fail everything and they shouldn't be there. And this is why I think that misinformation is a strong form of violence against women. So is it common? Well, I hope you like this picture because this is 15 minutes away from my cottage. So if you visit Quebec, I'll bring you there. And but this is just a little comment. So it is really common. So in Canada, we had data last year in 2023 that shows that 43% of Canadians were not always able to tell the difference between is it true or not true. So if 43%, that is a lot. And usually when you do poll on social media, It's people who are there all day long. It's not grannies. It's not grandmother who never seen a computer. Those are people who are active all the time. And there was a very nice article by the Kennedy Business School in 2019 that polled 142 countries, and that were able to show that the misinformation was higher in Latin America and the Caribbean, up to 74%, and lowest in South Asia. So it is there. It is really there. And the victims are the ones who are usually digitally literate. So just a few examples. So last year, this study was published in 2022. Last year, we had to do an intervention about the IUD and TikTok. I don't know if you've seen that in your country, but it was terrible. So this study was published in Obstetric and Gynecology journal, and they reviewed the top 100 videos on the IUD, and they were able to show that there was 471 million views. That is a lot of people. That is a lot of people. And out of that, 37% had a negative tone, 27 mentioned distrust of healthcare professional, and they were really bad. And if you want to go back to TikTok, you're going to see young girls fainting, throwing up while they were having an IUD installed, screaming to show how painful it was. This is bad. So how are you going to be able to recommend an IUD, which is one of the best contraceptive methods that we had since the birth control pill was invented in the 60s? How are you going to be able to convince a young girl? So what we did at SOGC, we did a position statement on pain management, and we shared it with healthcare provider. We did something for patient as well, but that's hurting. Because we were in Canada, when I used to be a pediatric adolescent gynecologist, and we used to have a very high rate of teenage pregnancy when we started to put IUDs, especially the levonorgestrel IUDs in. Teenage pregnancy went down, 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 down. And this is how we empower them to have kids when they're ready to have them. So this is hard to beat. So you have to be aware of that. Because when women comes in your office, you have to know that these things exist. What about fertility? Fertility is a disease. It's not a choice. 15% of the population have a fertility problem. And sometimes we don't have any treatment, because sometimes we do an investigation and we don't find anything. But these influent people have a treatment that's going to work. So this site, the Baby Mama Land, is the site where they sell gummies and they tell their whole story. Once again, very influent people making women that they fail. They were not able to reproduce. So first you bring them in this algorithm in the echo chamber where there's going to be sticker of you fail. Oh, you tried that, didn't work. So at the end of the day, they feel that they fail. Well, when it's going to work and they have a miscarriage, obviously you set the table for perinatal depression after that. But this is how it works. And these people tell their whole story. They share their IVF bill, and they pretend that if you do all of that, you're gonna become pregnant. That's another new trend at least in America, the trad wife. So this comes from a Mormon group who are making the promotion of the stay-home mom, that you shouldn't use any kind of contraception. You should have as many kids as possible. You should serve your husband and be nice in every way and wear those very nice dress and grow your plants. Well, if it's your choice, I don't have any problem with that. I would kill myself personally after 2 weeks, but some people may choose that. This is okay. I have absolutely no problem with that. But it has to be your own choice. This platform is terrible. So to be a member, you have to pay 400 Canadian dollar, and then when you scroll onto it, it always ends up with a special Chinese tea between $200 and $300 per month, and it's personalized. Once again, they ask you a bunch of questions about your personal information. Guess what they do with that? They make probably much more money selling the data of all these women who give their personal information than selling all these teas. I don't think that women get more pregnant, and then they get into the competition. My tea is better than the IVF. It's more accessible money-wise and all of that. And then we have all this misinformation on abortion. So it is there. And since Roe versus Wade, misinformation is more than ever. So you have all these homemade recipes for information. The law is changing very quickly in the US, and unfortunately, women don't know because you don't care. I mean, you can be pro or against. You don't care about abortion until you see this little red line on your pregnancy test. And then you say, oh, what do I do again? Where do I go? Where do I call? Is it legal? Am I going to go to prison if I get an abortion? So this is bad, but this is there. And it's going. And when we see on the news that, unfortunately, some healthcare providers are going to be targeted because they are still providing services and it's at the limit of criminalization, unfortunately, it doesn't have an impact only on abortion. It has an impact on miscarriage management. So unfortunately, in some states, people are so afraid to have to deal with the limit of life and criminalization that women just go back in their car and have their miscarriage. So this is really bad, abortion and misinformation. And now we see that again. So this started, the abortion pill reversal started in 2021. Now it's back. It was back last year. It was back this year also. So these are pro-life group again, and they are very active and very powerful because I can tell you they're against me all the time. I don't care. I don't read it. I just post. So it's a recipe that if you started the medical abortion process and you take high dose of progesterone, you will be able to stop it. But there's no way back. So we had done a position statement in 2021, the SOGC, but then we pulled it again, just to say to women, this is not true. Don't do that. You may have seen, I've seen some Mobius syndrome with the misoprostol side of it. We don't want that. So we have to be very strong on that. But when I did a couple of media interviews on the abortion pill reversal, I got hit so bad, There are dogs like watching your legs. They just bite you many times a day on social media saying that I was reinventing science. So guess who is? Some other disinformation. So there was a bill. So it's not only influent people, sometimes it's legislators. So there was a bill that was proposed in Ohio, in the US, and this was posted by the Cleveland Clinic. Cleveland Clinic, they have much more to do than fighting misinformation in the media. But this bill suggested that OB-GYN should be removing an ectopic pregnancy and putting it back in the uterus because this is life. So we know it's impossible. So they had to take a position on that. So it just shows you how bad it could be, because then what do you think? If I'm an OB-GYN, I don't really believe that, but I don't know, maybe someone else is better than me and I should be aware of. Did I miss something? So this is how it gets. So we know that the impact, if we keep all this misinformation on abortion, will have an increase again in maternal mortality. And there are some studies that show the increase could be as high as a 24% increase. But if you look at Black women, they're the ones who die. Maternal mortality in America, it's poor Black women, rich Black women, poor white, rich white. This is how it works. So if you don't allow access to abortion and safe abortion complication care or miscarriages, they're gonna die. We know it. Numbers are there. And then you have the fake TikTok doctor account. So usually it's always nice people wearing scrub in a clinic setting, wearing lab coats, and they go very personal. So this is why women get caught, because they say, well, I wouldn't put something on my personal sex intimate desire on social media if it was not true. But she's paid to do that. She doesn't care about, she could be selling vitamin to grow your hair, but that sells more, that pays more, because you put your face with a sex issue. So of course she's gonna be very well paid. And then you have some other influent people, like this nurse Heather, that is probably not a nurse at all, but put off picture. And this was one of the big fight that we had last year with social media. It was the Natural Cycle Lab that was unfortunately adapted very quickly by the FDA in America, Health Canada in Canada, and that we had to put a group together and put a statement on our website just to kill it. But in the meantime, this nice nurse Heather, who said that it was the best thing that ever happened to her, had 2.1 million views on Instagram. So this is the Natural Cycle Lab. So I did a lot of media on that, and as I used to tell them, you know, if you want to kill your sex life, sleep with your phone in your bed. This is the best way to kill it. So this is lesson number one. Put the phone away and have a safe contraceptive method, because they claim that this app was 93% effective. So even on cycle one, we know that it's impossible, but most of the women don't know about it. So once again, we did a position statement. We gathered a group of experts. We reviewed the science, reviewed the evidence, called the company, asked them to give us the studies that were all sponsored by the company, and were able to take a position. Reddit is another sources of unverified health advice. So this one, it was the recommendation on free birthing, delivering at home, how safe it is, and blah, blah, blah. Once again, no one has a credential into that. But the psychological impact of misinformation is really there, though. It's already there. It erodes autonomy of the women. It induces fear, anxiety, and we know that our young folks, I don't know here in India, but I can tell you that in America, anxiety is it's a contagious disease. It's worse than any disease that we had before. Young women are very anxious, and when you talk about fertility issue, in Canada, the age of the first baby is 31. So obviously, your fertility gets down very quickly if you don't follow the recommendation that you shouldn't wait until 40 before you get your first baby. And and the bad part of it is that they are so strong, these influent people, on their recommendation, that it undermines all the good work that we do. All. So they don't trust us. And the last thing you want is to have a patient with ChatGPT and being part of the consultation and telling her not to do what you're recommending, but it's yet to come. So if you look at it as a society impact, well, it's going to influence policymakers, as we saw, but it's also going to increase health costs. And healthcare is really, really costly already. And we know that it's going to have an impact, and especially in certain communities that have already negative outcomes. Poor women, women of color, women who are influenced by their religious group, who are there to take their decision on their behalf, no matter what the topic is. So what can we do? So it's something that we have all of us to be engaging in, and especially the medical society, because we need to educate the public. We have to be there. We have to be nice. And as the prior speaker said about litigation, this is the same, total same attitude. We have to be nice. We have to be there on time. We have to follow and monitor the social media up to know what's going on and kill it as soon as it comes it comes posting. So we need to teach digital literacy, and not only to grandmother, but to young folks as well, what's good, what's not. We have to help women to find the reliable organization body and to get the information there. And we have to raise awareness about algorithm. How can we do it? Government need to work with us. They need to regulate AI-generated content. They need to increase transparency in the influencer market. This has to be known. You should be able to see, is it a reliable sources or not, or just put it away. And they need to address the algorithm biases. So how can we do that as an OB-GYN? We have to be there. We have to be there and put the content that is reliable and that is done on a time basis. And if you can beat them, you have to join them. So this is Azitri Ramirez, one of the past WADOG president. WADOG is the World Association of Trainees in OB-GYN. I met her at the meeting in Mexico in November. So Azitri is really, really engaging young folks to get into this market, to talk, to be nice, to be reliable, and to repeat, but the truth, not the bad information. So how did we do it at SOGC? And we're not better than anyone, but this is what we did just to try to stop it and kill it when we could. And a good example was we did a big campaign in the fall for the RSV vaccination, because in North America, it's really bad. A lot of babies are dying because they don't get vaccinated, and now we have vaccination available. So we did a position statement, French, English, science. We take the science, same science. We do recommendation for healthcare providers, same science. We do recommendation for patient, French and English. We do videos, we do podcasts, we're present on social media. This is how we have to work it out. So this is a position statement. We work with the government as well, and I was really pleased that we were able to influence them to pass a bill. This is Mrs. Marcy, and she's the Minister of Women Equity, Gender Equality, and she was able to pass a bill that all charities that have pregnancy crisis center have to say loud and clear, do they offer abortion services or do they refer women to it? And if they don't, they lose their charities credits from the tax income. So it's a very big incentive to change the way you're going to do it. So we have to be there, because at the end of the day, when we're there, most of the time women trust us, but we have to be there. And it's not new that Canada gets engaged in being pro-choice. And this is an old picture of Trudeau's father, the father of our Prime Minister who dismissed last Monday. In 1967, he passed a bill that there was no place for the state in the bedrooms of the nation. And this is still really accurate, and this is how sexual health and reproductive rights should be taken. So tips and tools to spot disinformation and to be able to see your emotional red flag. And this is a discussion that we have with the communication team and scientific division at the office is, who's responsible for that? Is it the family or is it the school? Nowadays, unfortunately, there's a trend, again, I hope it doesn't get to your country, in North America, that parents are oftentimes overwhelmed and Just something that we've always been doing, like potty training our kids, is sometime wait forever until even when kids go to school, so it's horrible. So before they get into the digital literacy, it's going to take forever, but it has to get done. And it cannot be done only at school. It has to be done at dinner around the table, and we have to talk about it with our kids. What do you look at? Computer should be not in the bedroom, should be in the family room. It should be somewhere when you can have a little look on what they're looking. There should be more parental guidance. Australia passed a bill on the use of social media recently, and it doesn't mean that we want to stop it, but we want to make sure that kids are going to be able to know this might not be right. I should have for question. So usually, if you are paying attention to it, the emotional red flag should include every side that just triggers either a big emotion, like a bold statement on a controversial issue. So everyone is not taking any position, bam, out of a sudden you have a group that is taking a strong position. Vaccination are dangerous for kids, it causes autism. Okay, everyone said that it's not true. But when, you have a big statement like that, this is suspicious. When it makes an extraordinary claim, well, now we were able to educate the grandmother not to respond for their kids in trouble who ask for money. So we have to use the same marketing tools to educate our kids not to respond when someone asks them to send them picture of them naked, because there's a lot of kids that are abused with that. When it seems too good to be true, or when it contains a clickbait like "you won't believe this video," usually you're already caught. So in conclusion, we need to build a more informed society. So when you take a decision, it's yours, only yours, for the good and for the bad. And some women may make the bad decision for themselves. Our role is not to tell them that they're wrong, but to try to just go around it and just show them that there is an impact and they're going to be stuck with the consequences of it. But, if we confront them, it's not going to work. It is not going to work. So we have to have all these information. And I was really pleased to see last night that, and I put a note to myself to look at all this public information QR code that you were showing in the FOGSI activities that you've been doing. So that's really good. But, information is power.
Wow, that was a really, really impactful lecture, Dr. Diane. Thank you. In fact, I've never really heard anything like this before, because you've touched upon so many things. Every single day we see on Instagram, on TikTok, whether it's starting from infertility, magical therapies, to contraception, new ways which doctors have never heard of, and abortion, and so many important issues in a woman's life where there's huge amount of misinformation. And I agree with you, it's so catchy that even as a gynecologist, even as a trained person, we get taken in and we start believing it. And sometimes I myself have forwarded some of these videos because they seem to offer such simple, wonderful remedies for difficult problems. So thank you so much for focusing on this extremely difficult subject. Very important, and the kind of information that you've given today is truly fantastic. So thank you so much for that. And I think Dr. Rishikesh wants to add something to this.
No, so I think even when I heard first on this topic, it was a totally different new topic. And that's what Diane is about. She is progressive, and this is the new age, and we have to continue to evolve ourselves with the time, change with the times, and embrace these new technologies, new information technology, new things like Instagram, LinkedIn, and God knows now Chat GPT has come in, Grok has come in. So there are so many things that are happening, at the same time. And I don't know whether we introduced, but Diane is also going to be the next treasurer of FIGO. She has come unopposed, and also the next organizing chair of the next FIGO World Conference, which will be in Canada, and she is going to take care of that conference. And would you like to say anything more, Diane, about this topic?
Yeah. Well, thanks again, Rishikesh, for this kind invitation, and Rishma as well. But I think that it's just a teaser, so it's gonna get worse and worse, and we have to be aware of that. And I think that the next step should be that we need to have young OB-GYN that are going to be involved on TikTok and on all these Instagram to be able to counteract. But you can't do that alone, because you're going to be eaten alive. Those people who hit you, they can destroy your career. So there's a way to learn how to do that, and that's what we're starting to do with our young resident and medical students, so we can protect them and make sure that they're not going to be facing all these social media attack alone, because this could be hard on young folks. And now, I think that the next step is also going to be femtech, because we're not there. So women are looking, they want an answer now. So all this new technology, some are good, but some are not so reliable. So I think that we need to work on this digital literacy that needs to be taught at every level to kids, teenager, young adult, parents and grandmother, but we'll get there.
It is becoming, as you mentioned, increasingly difficult to differentiate the real from the real, right? The fake stuff. So is the remedy that you're suggesting, part of it at least, is to put our young proper gynecologists onto the same platform and tell them to actually be visible on social media and spread the right messages? So are we countering the fake with the real, at least trying to do that? Is that what you're suggesting as a solution?
Yeah, and at the same time, we just need to protect them, because now the technology, as I was saying, they can copy everything and make you say, and they can copy the voice as well and make you say a lot of things that are not what you said. So if you yourself alone just start to put good information in TikTok as an example, because a good friend of mine is an emergency doc at the cardiologist emergency center, and he was copied because he does a lot of social media, and he was copied, trying to sell pills to have a better sex life. He was never involved into that, but the video was exactly the same as some other video that he did before. So alone himself, I mean, he had a hard time to get out of there. So that's why, society has to be around our people and protect our young folks that are not going to be, getting out of all their social media life, because it's part of the daily life of everyone nowadays.
That's very, very scary, actually, your story that you're giving us. And we really don't want to subject the young generation to it. But I guess they'll have to go through all these trials and tribulations, So thank you so much. It was really amazing. And I genuinely would love to call you over and over again to our country to give this lecture, because this lecture needs to be listened to. So thank you so much for that. And
this particular 2 days, we have had 3,700 registrations and nearly 1,900 at any given moment online. And we are going to put this for 2 more months on, fine tune it, the presentations, and give access. We have not charged any money, and the trustee board of FIGO also decided not to charge any money for and endorse this, because we were also not charging any money. And The larger, wider thought process is to reach the people and reach our members and give them knowledge, and so that they can take that knowledge, take that learning, and apply it in their practice and benefit the women and children. Obviously, that's our main objective. So, thank you, Diane. You are a friend of India. You have come here many times, and looking forward to meeting you in Cape Town, where already 5,000 people have come. I have come to know that more than 5,000 registrations are there. Many Indians are coming, but I don't know the exact figure. It has crossed 200, but I'm sure it must be more, because we don't have the, we'll come to know the exact figure later on. But I'm sure that more and more of them will come to Canada as well, that to see for the next conference in 2027.
Thank you.
Thank you. Thank you.
Thank
Thanks for
you.
coming. Bye.
Bye.